Recording in progress.
All right, good morning, everybody. Thanks for joining us. As some of you might know, I'm Tony from the Mercy St. Luke's Family Medicine Residency Program. We're just down on Dixie in Perrysburg. And as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we're going to talk about taking care of our skin. It's difficult to ignore our aging skin. Each day we get up, we take a bath or a shower, and we look in the mirror and we start to, kind of look a little bit more closely. The other thing we do is we tend to look at other people and say, boy, I wonder how old that person is. Or somebody will say, well, I'm 50 years old. And then you're like, well, I thought that person was closer to 70 just based on how their skin looks. So sometimes we judge people like that. And some of that skin, some of our skin conditions are genetic, some of them are environmental. We're going to talk about that a little bit. But basically, our skin starts rejuvenating itself after the age of 30. And after the age of 50, our skin starts to be a little bit more at risk for things like skin cancer and precancerous growth. So that's when we need to start looking at our skin a little bit more closely. I've got a few bullet points today, and my first bullet point is I want you to keep doing 4 things related to your skin. Keep an eye on it. So not just, looking in the mirror and looking at your face and that, but truly when you get out of the bath or shower, looking over your skin to make sure, do I have any new spots? Is it something that looks pretty innocent right now, but maybe a couple of weeks later or a couple months later, you look at it and like, boy, I don't remember that looking like that. So keeping an eye on it. Keep it clean. So we'll talk about that here in a little bit, and trying to avoid really hot showers or really hot baths. Keep it hydrated. You can do that a couple of different ways. We're going to talk about different types of lotions, moisturizers, creams that you can apply to your skin, but certainly water, and keep it from itching. That's one thing that I can't stress enough. A couple weeks ago, I was out of town. My wife's family has a cottage, and the woman next door is in her 80s. And I saw her family, who live in another cottage down the road, come running. And I said, what's going on? And they said, well, she's bleeding all over the place. And so I went in, and there was a lot of blood all over the place, and she's sitting in a chair, and I said, what's going on? She says, I can't stop bleeding. I took a shower and I towel dried, and then she goes, I felt something and I thought it was a scab, and so I picked it, and she started bleeding like a fire hose. I mean, it just was going all over the place. Well, we got a leg elevated and we got put pressure on it, but it was something that was on top of a varicose vein. And that's one of the worst things you could do is pick something like that. So, we just talked about how you should, when you're getting out of the shower, pat dry, don't, rub and really hard and everything, because you can irritate your skin like that. Actually, our skin is the largest organ of our body. And it consists of different layers. I don't actually have a picture. I should probably include a picture of that next time. But in addition to that, our skin has something called melanin, and that's what gives our skin its color. So some people have more melanin than others, and sometimes you can see people with splotchy skin that is reflective of different skin or different melanonin tones there. But our skin provides many different functions. Certain areas of our skin are thicker than others. It regulates our body temperature. It serves as a warning sign to other diseases, and it helps our bones stay strong. So last month we talked about heat and summer precautions, and I talked about being outside. And I also talked about this when we talk about preparing for winter. Our face is probably has some of the thinnest skin of our body. So around the edges of our ears, around our lips, around our nose, and around our forehead. That's why you typically see a lot of people that develop skin cancer are typically having it first occur around their face because of how thin it is. And obviously it's that area of our body that gets the most exposure to the sun. So, so it also changes as we age. We lose moisture and thickness, our melanin and our color decreases. So you see people get a little bit, not have as much of a tan in that. And the other thing is we lose elasticity. So for a younger person's skin, you can sometimes pinch it and it'll go right back. Sometimes with older individuals, if you kind of lightly pinch your skin, it takes a little bit longer for it to fall back in place. We bruise more easily because again, number one, because of the changes in the skin, and number two, because a lot of people who are older end up on blood thinners for one reason or another, either because of previous history of strokes, heart history, even things like baby aspirin. Those people are a little bit more prone to bruising a little bit more easily. So what are some of the common conditions? It says here first would be dry skin. As I've said a couple of times already, avoid hot water and long baths in drying soaps. So there's, when back in the day, we only had a couple of soaps. We had Ivory, Irish Spring, things like that. And now you go to a store, even a health food store, and there's a whole row of things, and you just have to be consumer conscious. What works for me may not work for you, so you need to just think about, what works best. The one thing you want to do is try to stay away from soap that are very high in fragrance, because the fragrance inside those fragrance inside those soap products can actually irritate your skin. Again, try and apply lotion immediately after you take a shower, because that's when it's going to be able to absorb things the best. And again, some of us don't have the dexterity or the limberness to kind of get everywhere. Just get where you can. If you're trying a new lotion for the first time, I recommend that you first try it just a little bit here, a little bit here, maybe a little bit on your thigh or something, and watch that for a couple of weeks to make sure that you're not having an allergic reaction to something. Because there's worst case scenario, you're like, oh, I got this new lotion, and you put it all over your body and you're allergic. Now you're miserable until you can, get some attention for that. The next type of skin condition is nevi, which is just a fancy way of saying moles or keratosis. This is where I talked about after the age of 50, our skin's more at risk for skin cancer and precancerous growth. That's what keratosis is. We tend to get more dry, itchy skin. Some of us know it as a fancy word as psoriasis. And then wrinkles, age spots, sores that won't heal. And we're going to talk about those here a little bit on the next page with our visual. And then seborrheic dermatitis, fancy way of saying dandruff. Contact dermatitis. This is probably something that I tend to see the most. Having worked the emergency room and then in our doctor's office, and that somebody will come in and say, boy, I'm having this rash and I don't understand what's going on. And sometimes we got to really dig deep down and find out some history here. And a lot of times contact dermatitis is a result of trying new clothing, trying new bed sheets, things like that. It might be a polyester or a cotton or something. Different manufacturers do things differently. So you might say, well, I've worn cotton or polyester or whatever for all my life. It might be that particular one. So a lot of times when we see people coming in, we'll see people with a rash like right here and on their back, and it tends to be, well, I just got this new shirt or something like that. And so we kind of gotta watch out for that. Seborrheic keratosis are non-cancerous growths on the face, neck, chest, back. They're usually brown or light tan. So these are the ones that we tend to notice the most, just because they stand out a little bit. And those are the ones that I said about before about keeping an eye on things that we really got to watch, are the change in shape, color. We'll talk about that here in a little bit more. Most people, when they think about taking care of the skin, one of the things they fear the most is skin cancer, and they should, because it is very common. Basal cell skin cancer is the most common, happens about 80% of the time. So 8 out of 10 people that have skin cancer typically develop basal cell. That tends to be more on the surface of the skin. And some of that stuff can be handled through certain primary care physicians. Sometimes you need to get referred to a dermatologist, which is my next take-home message. If you start to see something that is of concern, don't hesitate to make an appointment with your primary care physician, because together the both of you can monitor this. This is something that, like in our office, we can do like a scraping of that skin and biopsy it and take a look at it in our office. We can do punch biopsies to take a look at it to see if it's something that is of concern. Because the longer you wait, this might need to be something that gets referred to a dermatologist. I don't know if any of you have gone to a dermatologist in the last couple of years, but right now, with it being the middle of July, they're probably scheduling out until February. So now you're waiting for several months and you're having to go through the holidays and everything, wondering and concerned, oh my gosh, is this cancerous? Is this going to get worse? You know, things like that. So the quicker you identify something, discuss it with your physician and get a better plan in place, the better the outcome will be. The next type of skin cancer is squamous cell cancer. It's the second most common. It's actually more prominent in African Americans, but certainly Caucasians can get that as well. It tends to be, you see it a lot with sunburns, other burns and sores. It just kind of develops into something because, again, we're going into a deeper layer of skin. And then melanoma is the third type of skin cancer, and that's the most severe and tends to have a less fortunate outcome. The other thing that we notice in terms of skin conditions too is skin tags. It's not listed on here, but they are annoying. That's about it. They're annoying. The problem is, back in the day, you used to be able to go to your doctor's office and say, hey, I want this skin tag removed. Well, they don't do that anymore because it's not something they can bill for. And there are different over-the-counter products out there that you can use, but I would just say, if you're going to try something like that, it might be best to go to the pharmacy window at, Walmart, or I can't say Rite Aid, CVS, somewhere like that, and talk to them and be an informed consumer about what type of product you're gonna use. So what can we do to kind of protect our skin? The first thing is stop smoking. For those that have smoked, smoking does a couple of things. It causes a lot of wrinkles, but it also interferes with the normal blood flow of our skin. So we always think of smoking in terms of lungs and lung cancer, and that it certainly has its effect on skin as well. Doing regular skin exams, not just you. If you live alone, making sure that during your annual wellness exam, when you go to your primary care physician, that you are making sure that they're looking at the different parts of your body. And for those that are diabetic and that, making sure that they're looking at your feet as well, taking off your shoes, looking at the under part of your foot and that, because there are a lot of times that some skin issues develop in places like that. And we don't necessarily have the ability to look down or look under our feet and identify that. And as it says here as well, don't forget to look at the scalp. It's very hard. You can't look in the mirror and put your head down and go like this and expect to see the top of your head. You need to have somebody looking at that and making sure, because a lot of like for older men with the balding patterns and that, you'll tend to see they tend to get a little bit of scabbing up there, and that tends, just like the other thin parts of the skin, could be make you skin cancer prone. So look for the A, B, C, D, Es. That's this part here right above the pictures. And A is for asymmetry. So you can see here that normal is going to be nice and round about, or kind of look like a dime or a nickel or a penny when that's symmetrical. Asymmetrical means the borders aren't even all the way, or that it's not, doesn't look the same all the way around. B is for border. You can see on the top picture where it's normal that the borders are even, and down below, and again, this is melanoma. This is worst case scenario. The borders are very uneven. So I'm just trying to give you, conceptualize a picture in your head of when you're looking at your skin and I say, hey, there's a spot, taking a look at it over a course of a couple of weeks and seeing if it's changing like this. Another big thing is color. Is that spot staying the same one color, or is it starting to have multiple colors, like dark in the middle, and then sometimes it almost get black? That means like some dried blood in that, and you know, kind of fading out around the edges. D is diameter, or the size of that particular skin spot. Typically it's less of a concern if it's smaller in diameter. It says 1/4 inch here, almost like the tip, like a pencil eraser. That's what I always think of. Or is it getting larger? Is it kind of expanding out? And then E is evolving. So you can see here, I use E for 2 different things. Number one's evolving. You can see here, there's a couple of spots, and now they're changing, and you're getting multiple ones. They're changing in size, shape, color. The other E is elevation. Sometimes they're normally flat, but they might start to get a little bit raised and get a little bit of height on them. So that's something that we need to take a look at. The other thing is, if you're having skin conditions like this, we all have, for the most part, cell phones now. Take a picture of it, and then a couple weeks later, take another picture of it. And that way, if you're going to be going to the doctor, you can say, hey, here's what it looked like before, here's what it looked like 2 weeks ago, and now 3 weeks later, here's now what it looks like. So your doctor can see the progression of things as well. Because it's kind of hard to describe to your doctor, well, this is how it looked a couple of weeks ago, and you know, here it is now. So I think that's always a good thing to do. If you've had skin cancer in the past, you're more prone to having skin cancer again in the future. So you definitely want to do due diligence and keep an eye on things a little bit more closely. As it says here, and we talked about this last month, with heat and summer precautions, things you need to do: wearing light, loose fitting clothing, wearing sunscreen, staying out from outdoors between 10 a.m. and 4 p.m. You know, all those things we went over before. And then on the next page, I have just some products here in terms of moisturizing your skin. I'm not endorsing one of these over another. And the other thing I didn't list on here, and I wish I would have, because this is the one I use, and I'm not promoting this product by any way, but is CeraVe. CeraVe tends to be a good one. But again, some of these cost more than others. You need to think about what's affordable to me. Let me not buy the big tub. Let me buy like the travel size and try that out first to see if it works for me. If I feel that my skin is responding well to it, that I'm comfortable applying this in larger areas, then you might want to buy something a little bit bigger. But the worst thing you could do is buy something big and not be able to use it anymore because your skin is having a reaction to it. Again, also have on here the different types of sunscreen. You definitely, as I mentioned last month, want a sun protection factor of 30 or higher. Somebody actually asked me at the last talk, they've heard about sunscreen in pill form. And there is such a thing. It is not, to my knowledge, FDA approved. So there are infomercials are out there that say, hey, you don't want to spray, you don't want to have to rub all this stuff, take this pill. You know, just buyer beware, be an informed consumer about things like that. And then, we have, actually I went backward, the moisturizers here. So again, it says to create a protective seal for the skin, ointments are best, creams are second best, and lotions are the worst in terms of, again, providing a seal. So when you're getting out of the bath or shower, think about what you can afford, what works best for you. And some people have different reactions to different things. But you always want to try, just like I said, with the soaps being fragrance free, you want your lotions, ointments, creams to be fragrance free as well, because those can be an irritant to the skin. It's kind of a basic overview. Anybody have any questions?
The aging spots, are they a mole or just?
No, well, yeah, they tend to be nevi. They tend to be, it could be a change in the melanin and that. It just depends on, you know, you see that in a lot of people and it just tends to be, I don't want to say a normal part of aging. It's just a different, it's a change in your skin condition that could be just a couple of few, or some people are just gonna get them a little bit.
Nothing
To worry about unless the ABCDE that I was talking about starts to, you start to notice something different about it.
Okay.
Hopefully you found this, yes, ma'am.
You have this diagram up here
Mm-hmm.
about the normal of the melanoma
Right,
causes. Are those chemical changes? Is cancer chemical that causes the changes in those?
no, that would be, I mean, just like any cancer is, you know, I don't want to say like a toxin, but it is something that, I mean, there's different cancers on different parts of the body that have different, reasons for the cancer. And it's kind of hard to explain.
They act differently.
They act differently, yes,
Depending on where they are.
sure,
Oh, I
sure.
see. And is that taken into consideration then when the cancer is treated?
Absolutely. I mean, number one, you have to determine what type of cancer it is. The other thing is, you know, how are we going to approach these cancers? A perfect example is I know a young lady in her 40s who ended up having a little spot right here, and it ended up being a squamous cell. So it's one that she's fair skinned, and because it was on her nose and that they had to send her to a dermatologist, they ended up doing something called a mole procedure, not like removing a mole. It's the acronym for the procedure. Then she had to go see a plastic surgeon because they have to go so deep in there that it needs to be with the skin flap and everything repaired. So you, again, just some of those are a little bit different. I mean, good questions. Thank you for your time. I appreciate it. Have a good month. Next month, I'm gonna be here with Dr. Rubin. We're gonna talk about vitamins and supplements. So, thank you as always. And thank you for your time.
Thank you. Our lotions are good.